The IMerge trial is a study that is evaluating transfusion independence achievement in patients with IPSS intermediate or low risk who have high burden transfusion dependence, so more than 4 red blood cell units in 8 weeks, and is comparing Imetelstat, a telomerase inhibitor, to a placebo. So the trial was successful. 40% of patients treated with Imetelstat achieved transfusion independence longer than 8 weeks versus 15% in the placebo arm. So the drug has, it's very interesting because it may indeed induce long duration of response. The majority of patients achieving the primary objective of transfusion independence for 8 weeks will have 6 months of transfusion independence. And finally, of all the patients, the intention to treat patients, 18 will have a transfusion independence longer than 1 year. So we focused on this subgroup of patients because we wanted to understand whether this long transfusion independence was mirrored by a longer survival. So in the intention to treat, all the patients versus placebo did not show a significant prolongation of survival. But when we look at the more than 1 year transfusion independent patients, you indeed have a signal, especially after 42 months of survival. So the study was not powered to evaluate overall survival, but there is a trend to obtain a better overall survival in treated patients. Now, this is just the beginning. We have to understand exactly the characteristics of patients, whether they had other treatment after Imetelstat, but it's an encouraging data. Also because this drug is endowed with disease-modifying effect, meaning that the variant allele frequency of the somatic mutation present in the patients is decreasing significantly, and this correlates with the response.